Hello, I'm Dr. Paul Miller. I'm an orthopedic spine surgeon here at the Great Falls Hospital. When often asked what is spine pain and when should I see a spine specialist or go to my physician, we normally recommend starting simple, activity modifications. If there's something that hurts you, avoidance. Activity and strengthening is really key in preserving spine mobility and health. When those are no longer working for you and home remedies aren't, then we should seek medical help, such as your primary care physician or even coming to see a spine specialist. We normally will start with something with physical therapy and move on to more aggressive treatments, injections. We always try to focus on more conservative care, and surgery is always the last thing that we recommend. So what steps are taken to determine whether a patient needs non-invasive measures, conservative care versus surgical intervention? There's a continuation here. We always try to do the least invasive steps first, whether it be non-op or injections, and surgery is really reserved for the end stage. We start with conservative measures such as physical therapy, anti-inflammatory medication, and then we will move traditionally to more of a injection when the therapy and anti-inflammatory medication has failed. Once all that's gone, then you're left with pretty much either living with your condition or surgery. When we get to surgery, it is truly tailored based on your needs and what we see on the MRI, X-rays, and other modalities of imaging, and how you've responded to the injections and other conservative care measures. What advancements have we had in orthopedic spine surgery? Spine surgery has evolved tremendously and continues to evolve tremendously over the course of decades to just even the last several years. Some of the most recent and I think some of the most beneficial and biggest impacts have been with the implant market, as well as the technology such as intraoperative live navigation. It has really changed placement of pedicle screws, alignment of the spine, and we've really been able to tailor spine surgery to a person rather than a more generic where we're just putting screws in. By having that specificity of screw placement, it's really allowed us to enhance patient care and get more of a natural position of the spine.